Last night I was up at my desk late reading a report that just came out from the National Bureau of Economic Research, and it was documenting our leadership in cancer. Right now, if you are seriously ill, the best place to be is in the United States. We are #1 in cancer survival rates for 13 out of 16 forms of cancer, all the most common forms of cancer. We don't want to give that up.
The microphone over there, please just let us know your name and your question to the doctor.
You know, I'm a PhD, I'm an MD, so no diagnostic.
Hi, my name is Jerry Manicotti. I'm a professor at Greensboro in history. My question is, and this is there's two parts of it. So the first part has to do with unions. I'm a member of a union. I have very good coverage. And why would unions give up this coverage? I know a lot of people are not going to like this, but I work for the city of New York, and I have great coverage because of that. Why? What would happen would be cities all over the country and states are going to drop all the union people, put them into this plan, which is going to be, I get dental, I have $10,000 worth of dental work. They're going to stop that. They're going to put you in this plan. So why would union people be in favor of a plan that's going to allow city and state governments to get off the hook on their medical benefits, which they promised me from cradle to grave?
$10 million.
Do I have to come up there?
No.
Okay, good. I have a last question. There is something I don't understand. I hope you'll bear with me. My daughter actually asked me this question. If we're going to have single payer, I don't understand. In England, I believe in single payer, everybody gets the same thing, whether you're in Parliament or not. In the United States, if we have single payer, what happens with the Congress since they don't have
Okay. First of all, it isn't single payer. And in the HR 3200, there is a public option, they call it. We don't know whether that will persist. In the Kennedy bill, there's just simply a white space on the page where it says public option to be included, but there's literally not even a sentence describing it. So it's hard to say what will happen. But in either case, it's not single payer, because in a single payer system, the government can provide direct payments to doctors and hospitals for everyone. And this is, in these bills, is just considered one of the options. So it's not really single payer. And of course, in England, as you know, there is a private insurance sector as well that some people take advantage of.
So in other words, so what I'm trying to say is same thing. If some people insurance and some people trying to equitable, how is that going to be equitable? Because people who have money still get better than and other people won't be able.
That's right.
So isn't it the same thing?
Yes, and of course, when I was reading through the Kennedy bill, I was so disturbed to see on page 14 that members of Congress and other federal employees are exempt. Now I've heard they're going to do something about that.
We'll ask Congressman Ackerman what he thinks about that.
We take two more questions for the doctor.
Yeah, hi, my name's Ray Heemson. I have a question regarding rationing, which they say is a farce, right? It's all misinformation, but I'd like to know from the congressman, if they're going to add, if we take their numbers to be true, and there's 45 to 50 million people that are not currently getting health care in this country, and at the same time we're going to be adding them to the pool of people who are getting health care, while at the same time they are reducing the fees that the doctors are getting. And then, how is that possible? You can do that without rationing, especially in light of Ezekiel Emanuel's article in The Lancet last January.
Good point. The numbers don't add up. They don't add up for seniors, 30% more seniors in Medicare, and a 10% reduction in future funding. And they don't add up for everybody else. 47 million more people insured, and the president has said he's going to slow the growth in healthcare spending by 25%, right? It will mean that people who already have care will get less care. And one sign of that is already in the law. If you read the stimulus legislation that was signed into law on February 17th, slipped into that, was a provision that protocols will be delivered to doctors electronically on what the government deems appropriate and cost-effective care. And doctors who aren't meaningful users of those protocols eventually will be penalized financially through Medicare and Medicaid. So already there's an infrastructure built to limit your doctor's ability, your doctor's leeway to make the best decision for you. And I'm already hearing from doctors who say, these government controls are going to impede my ability to fulfill my Hippocratic oath. And we never want that to happen.
I'm going to take one more question to the doctor. We do have an opportunity after the doctor is done taking those questions to ask additional questions to the panel. We have a couple other speakers. So right now, we're going to take one more question for the doctor before we let her take a break because her voice is suffering. Can we get...
Doctor?
Oh, we got it. All right, we got it. Go ahead.
Thank you. Thank you. Doctor, thank you so much for showing up. We really appreciate you and your wisdom. Thank you so much. My name is Andy. I'm from Blue Collar Corner. I also am a union worker. But I'm very curious about something they keep throwing at us, that we're ranked number 37th on the World Health Organization as far as our health status on the planet. Now, if that is true, please tell me who's number one and tell me if Chris Dodd and Ted Kennedy are getting treated there.
World Health Organization report last night. It is such a sham. And you hear the politicians citing it constantly. We spend the most and we're 37th, right? Well, if you really look at that report, you'll see we are ranked number one on responsiveness to needs of the patient. So how do you get down to 37th below Morocco? Because these are rigged numbers. They're ideological rather than based on medicine. Number one for responsiveness to the needs of the patient. But that only accounts for 12.5% of the total ranking. Then the big numbers come from equality of providing healthcare services. So Morocco and Oman and all these places, they're way up here because everybody gets the same rock bottom, right? Rock bottom, but equal. And the countries that provide healthcare for everybody through the government, that's deemed fairer, the single payer method. So those countries get very high rankings, and the U.S. gets a very low ranking. So even though we're number one for meeting the needs of the patient, responding to the needs of the patient, they get us way down at number 37. Who would believe such a preposterous thing? An organization called the Commonwealth Fund, very close to the administration, has similarly sham statistics. I'm just going to give you one of them. It's such a great example. The U.S. leads the world in breast cancer survival rates for two reasons. More women get mammograms. Women in the United States get age-appropriate mammograms, and that statistic reflects all women, not just those with insurance. And so they are diagnosed sooner and treated faster because we have more technology available for women who need radiation therapy. So as a result, we have excellent breast cancer statistics, well over 90% survival rate for 5 years or more. Fund, because they are dedicated to a single payer system, and they spew out all these reports, and they're very upset that we have such a high quality ranking. So last time they did the report, they decided to dispense with measuring survival after a cancer diagnosis. We're not even going to consider that. We're just going to measure the percentage of women who get mammograms, and there it was. The U.S. was right on top. So then they thought, oh, wow. So they said, okay, we're going to measure the percentage of women who get reminded that they need a mammogram.